Welcome to Masters of History. This is the series where we dive deep into the lives and legacies of some of the most influential figures throughout the ages.
Our master is William Morton, the pioneer of anesthesia. William Thomas Green Morton was born on August 9, 1819, in Charlton, Massachusetts. As a child, Morton had an ordinary upbringing and attended local schools. He initially expressed an interest in business and began studying at a nearby academy. However, his career path took a different turn when he decided to pursue a career in dentistry. Morton studied dentistry under the guidance of Horace Wells, a well-known dentist and early experimenter with nitrous oxide as a form of anesthesia. This mentorship played a significant role in shaping Morton's interest in the field of pain management and anesthesia. Morton began his dental practice in Boston, Massachusetts, in the 1840s. As a dentist, he was keenly aware of the pain his patients experienced during procedures. This motivated him to explore ways to alleviate their suffering. While Wells had been experimenting with nitrous oxide, Morton wanted to find a more effective and reliable anesthetic for his patients. William Morton's journey with ether began when he learned about its potential anesthetic properties from his acquaintance, chemist Charles T. Jackson. At the time, the medical field was searching for an effective and safe anesthetic that could provide pain relief during surgical and dental procedures. Morton initially tested ether on himself, inhaling small amounts to gauge its effects. He experienced mild side effects such as dizziness and drowsiness, but the experiment confirmed ether's anesthetic properties. Morton then conducted experiments on animals to observe how ether affected their responses to pain and consciousness. These tests provided further evidence of ether's potential as an anesthetic. After confirming the efficacy of ether, Morton began using it in his dental practice. He successfully administered it to patients undergoing tooth extractions, noting a significant reduction in pain and anxiety during the procedures. Morton's patients experienced a smoother dental experience with minimal pain, which validated his confidence in ether as an anesthetic. Morton meticulously prepared for the public demonstration of ether at Massachusetts General Hospital. He was determined to prove the efficacy of ether as a surgical anesthetic and carefully selected a patient and a surgical procedure for the demonstration. On October 16, 1846, Morton administered ether to a patient undergoing surgery for a vascular tumor. The procedure was a resounding success, with the patient feeling no pain and the surgeon able to operate without interference from the patient's movements. Morton continued to refine his technique for administering ether, focusing on the right dosage to maintain unconsciousness without causing harm to the patient. What about patients' reactions? Initially, patients experienced various side effects such as coughing or nausea when inhaling ether. However, Morton worked to improve the delivery method to minimize these reactions. Morton collaborated closely with surgeons to understand their requirements for effective anesthesia during operations. This collaboration helped standardize the use of ether in surgical settings. Following Morton's successful demonstration, ether quickly gained acceptance in hospitals and medical practices across the United States and internationally. Morton played an active role in educating the medical community about the use of ether. He advocated for its adoption and provided guidance on proper administration techniques. Morton's work with ether earned him recognition and respect from his peers. He received accolades for his contributions to the medical field, despite facing challenges from rivals such as Horace Wells and Charles T. Jackson. Morton's legacy as a pioneer in anesthesia continued to inspire future generations of medical professionals to explore and innovate in the field of pain management and surgery. The introduction of anesthesia also led to significant advancements in surgical techniques. Surgeons could now operate with greater precision and take the time needed to perform intricate procedures. This opened the door to new possibilities in medicine, such as the development of modern surgical practices and specialties. Despite his groundbreaking work, Morton faced challenges and controversy regarding his discovery. Charles T. Jackson, the chemist who introduced Morton to ether, claimed credit for discovering its use in surgery. This led to a prolonged dispute between the two, which affected Morton's reputation. Additionally, Horace Wells, Morton's former mentor, felt that Morton had built upon his earlier work with nitrous oxide. Wells's contributions to anesthesia were overshadowed by Morton's success with ether. Despite the disputes, Morton's contributions to anesthesia were eventually recognized. He received accolades and honors later in his life. Morton continued to advocate for the use of anesthesia and contributed to its development. Morton's work inspired other researchers to explore different anesthetics and techniques. His legacy played a crucial role in the evolution of modern anesthesia, which has become an essential part of medical practice worldwide. William Morton died on July 15, 1868, in New York City. His passing marked the end of a remarkable life dedicated to improving patient care and advancing medical science. Today, Morton's legacy is celebrated in medical circles, and his contributions to anesthesia are widely acknowledged. He is remembered as a pioneer whose work paved the way for safer and more effective surgical practices. His legacy continues to inspire medical professionals and researchers, and his discovery of ether as an anesthetic remains a cornerstone of modern medical practice. Morton's contributions have saved countless lives and continue to shape the future of healthcare around the world. William Morton, the father of anesthesia.